We've now reached day 16 of the government shutdown, and Republicans and Democrats appear no closer to an agreement to reopen it. The Senate failed to advance a House-passed GOP bill to fund the government for the 9th time yesterday, attracting no additional support from Democrats, who are digging in their heels on an extension of health care tax credits in exchange for their votes. Lawmakers will vote for a 10th time today, but that is expected to fail once again. Also happening today, Republican Senate Majority Leader John Thune has scheduled a vote on advancing an $852 billion defense appropriations bill. It passed with strong Democratic support back in July, but the landscape might have changed. Thune is shaking things up on Capitol Hill with that vote, essentially daring Democrats to block the bill that would restore military paychecks as Republicans ramp up their rhetoric on how their shutdown is impacting national security. The Senate is expected to leave town then for the weekend after votes today, meaning the shutdown will likely last until October 20th. I caught up with the Majority Leader yesterday for an MSNBC exclusive and asked him how long he thinks this shutdown might last. Listen to what he told me. It doesn't sound like either side is changing their position. So how long do you think this goes on? Is this something that lasts through Thanksgiving, as some of your own members have suggested?
Well, I hope it doesn't last through Thanksgiving, because that's going to be a lot of harm to the American people. And
Hope
obviously
is not
a lot
guaranteed.
of a lot of harm to federal workers. There is a bill sitting at the desk right now that opens up the government. You all know that. The president would sign it today. The government opens up. It's simply a function of 5 Democrats joining the 3 Democrats who are already voting to open up the government. And I think that's the quickest way to end this.
So those are the stakes on the Hill. And then there's the administration's actions and the fallout from them. Because yesterday, a federal judge granted a temporary restraining order that blocked the Trump administration from laying off federal workers during this government shutdown. 2 unions sued the administration last month after the White House signaled plans to lay off federal workers through reductions in force. The judge granted the union's motion to issue a temporary restraining order preventing those cuts and ruled that layoffs are likely illegal, saying the Trump administration had, quote, taken advantage of the lapse in government spending to act as if the laws don't apply. Prior to the ruling, OMB Director Russ Vought said he expects the job cuts during the shutdown will probably end up being north of 10,000.
We want to be very aggressive where we can be in shuttering the bureaucracy, not just the funding, but the bureaucracy, that we now have an opportunity to do that. And that's where we're going to be looking for our opportunities.
So you're saying there's been a snapshot of 4,000 jobs cut.
Correct.
Is there a special, but it could grow much higher?
It could grow higher. I think we'll probably end up being north of 10,000.
Want to bring in senior congressional reporter for Punchbowl News, Andrew Desiderio. As soon as I booked the Thune interview, I knew that we had to have you because you know the Senate so well and these key players. I think for both of us, it's probably shocking to see the way that senators are just sort of accepting the fact that this is going to potentially be an historic shutdown. It's why I asked the Majority Leader if this could stretch until Thanksgiving. Hope is not a guarantee, as I said to him, and he's not guaranteeing that it won't end before then.
Yeah, I mean, I've never, in my time covering the Hill, seen both sides so entrenched, but also so comfortable in their respective positions, right? Believing that they are in the right here. Democrats believe that the only way that this ends is for President Trump to get more involved, but we see the president more preoccupied right now with foreign policy initiatives, right? He just came back from the Middle East. I mean, nobody's necessarily blaming him from going to the Middle East for the reason that he did, but under a normal circumstance, the president would not dare leave the country. The president would be trying to resolve what is an emergency situation on Capitol Hill, which is, of course, a government shutdown. So I think it's very possible at this point that this drags on well into November. And
I think what's so striking is the way that everyone's talking points, frankly, have remained the same from days before the shutdown all the way through now. The interesting thing that Thune is trying to do to shake up some of these dynamics is starting to put these appropriations bills on the floor. And we've sort of been untangling this for people throughout the week, the idea that this is a continuing resolution that punts funding and just lets the government stay open. But they are supposed to do their own funding bills that let them set the levels for spending for various agencies. So might this work? Might it not? What do you expect?
Well, the bill that's going to be on the floor today is the full year defense appropriations bill for the entirety of fiscal year 2026. So in terms of paying the troops, in terms of funding the military, this would do all of that. But Democrats, I'm told, are poised to block this bill today, in part because, number one, we're in a government shutdown, so they don't want to do this sort of piecemeal fund the government effort. And number two, they would still need to go to conference with the House. The House version of this bill, this defense appropriations bill, spends about $20 billion less than the Senate bill does. And so for Democrats, they have very little incentive to allow that process to move forward. The risk for them, of course, is that they could be seen as blocking pay for the military and blocking a full-year funding bill, of course, for the Pentagon, which Republicans will definitely use to hammer them politically. And so that's really the risk here.
Yeah, because the politics of this is percolating in the background. Even as everyone says, no, we're not playing politics, it's very much in the mix.
Yeah.
There's one other thing that the senator said to me, one of many, frankly, that I was struck by, specifically the way that he was talking about how this might end and what he's offered Democrats. I've never heard him say it like this. I want to get your reaction. Listen. So then what assurances can you offer Democrats that they will get a negotiation on this?
Well, I mean, I think, yeah, well, I've told them, I've said we are willing to have the conversation. I've said if you need a vote, we can guarantee you get a vote by a date certain. At some point, Democrats have to take yes for an answer. But I agree totally. We are all about getting health insurance down, making it affordable to more people.
So I hear you saying about the program that needs reforms. It sounds like you're guaranteeing that there will be a negotiation on this.
Well, what I'm saying is there's a path forward, I believe.
But yes or no?
It has to include reforms. And can I guarantee an outcome? No. I mean, and that's what people want to say. Guarantee us that this is going to pass. I can't guarantee it's going to pass. I can guarantee you that there will be a process and you will get a vote.
I can guarantee you a process and I can guarantee you a vote. That felt like a shift to me.
I think for Democrats, it's going to depend on, the president getting involved, because no sort of bipartisan deal is going to get through the House of Representatives in particular without the president really pushing for it and having that buy-in, right? He's proven to be very influential with members of his own party. He's gotten members of the Freedom Caucus to vote for CRs, which used to be an unheard of
Unfathomable,
concept.
yeah.
So if they do get a bipartisan deal on this, what Senator Thune seems to be saying is, of course, he can't guarantee an outcome, right? He can't guarantee that it will clear both chambers. But what Democrats are saying is we would like that guarantee to include a guarantee that the president is going to actually be pushing for this actively, because, frankly, he's the only one that can get members of the Republican Party, particularly in the House of Representatives, to embrace a deal like this, which, again, involves Obamacare, right? Something that Republicans tried to repeal for so many years, right? It's not going to be easy to get Republicans on board with this notion of extending a policy from Obamacare, but they do recognize at the same time that the politics of letting people's premiums spike in 2026, a year that, an election year that's going to be defined by cost of living issues. If you add on top of that, your premiums are going to double or triple, or you're going to lose your health insurance entirely because of this, Republicans realize that is a political vulnerability for them.
I think they realize it. And from Thune's perspective, I heard him offer more overt sympathy to those families who are entering a healthcare enrollment landscape right now where they actually don't have a certainty of what they're going to be paying, in large part because this negotiation is just hanging out there with a real big question mark at the end of it. So to me, the fact that he's now saying, I can at least control what happens in the Senate. And I'm telling you in the Senate, where the story is right now, that I could potentially guarantee you a vote on this, even though I can't guarantee you the votes to pass it, to me felt like a new overture from him in a public forum. But it doesn't solve the problem of the trust deficit that exists between these two parties.
Trust deficit on that, but also on rescissions, right?
Yes.
This whole idea for Democrats is, why would we agree to some of these full-year funding bills if the administration can just unilaterally rescind certain elements of it, not spend money when Congress directs it in certain instances, or redirect it towards something else entirely, which I think is a fair point. And it's something that even a lot of Republican senators have acknowledged, that, for example, the rescissions requests from the administration have been unhelpful in sort of engendering that trust between the two parties, because, again, the process lives on Capitol Hill, the appropriations process, right? That's where this all happens, and it's just up to the administration to implement it. What we're seeing under the Trump administration is that they are not just implementing the will of Congress, they are subverting the will of Congress in many instances and moving that money around and refusing to spend money that Congress has said you have to spend.
And I thought it was so striking. We talked about rescissions. We talked about the role of an independent branch of government as Congress. And I thought it was fascinating to watch the majority leader really try to assert that, even in ways that I don't think I expected him to, showing some discomfort with the rescissions process, showing discomfort when he's being told what his own members are saying about how that kind of poisons the well on these bipartisan negotiations that they're attempting to do. Ultimately, what's your expectation as we head into them going home for a weekend, no King's protests on Saturday that are only going to amplify Democrats, I imagine, hearing from their base saying, we want you to keep holding the line. Where does this go next then as we go into next week?
Well, look, there's a couple weeks left in October, and then you get to November 1st, which is the start of open enrollment.
Yep.
So once you get past November 1st and no action has been taken on the healthcare front of all of this, it becomes very hard to sort of retroactively deal with this issue. You could enact rebates. You could maybe extend open enrollment by a little bit. But again, once you hit November 1st, there's very little that Congress can do to blunt the full impact of these rate hikes, of these premium hikes. And I think that's what Democrats have their eye on right now, is that November 1st deadline and trying to up the pressure around then. Now, that doesn't mean that once we get to November 1st, Democrats are just going to be like, oh, well, OK, we tried.
Yeah, it's over.
It's over. We'll reopen the government. They think that the pressure will just sort of skyrocket on Republicans to take action. But again, that hasn't worked up until this point. So I'm skeptical that that will actually make a difference.
Yeah, and I think at the center of this, and we need to continue bringing it back to that because this town always trades in politics and power, but the way that this is about real people who are being impacted, who don't know how much they're going to have to pay for basic things like health care, but then also when are they getting their next paychecks? They finagled it for military families this time. What happens when they can't do that end run budgetarily anymore? There's so many open questions here. Andrew Desiderio, senior congressional reporter for Punchbowl News, I thank you for coming on, breaking this down with me.